You're watching Capital Connection from the Illinois State Capitol.
I don't disagree with them that different areas of the state require different rules during this time.
Governor Pritzker was responding there to a letter from the 5 Illinois Republicans in Congress. That April 30th letter reading in part, "The greater threat looming over Illinois is the collapse of our economy if your stay-at-home order continues in its current form." The letter reads, "It's unreasonable and untenable to continue on this course for the duration of the pandemic. We must therefore work with our public health experts to establish a path forward that no longer ignores the economy." It goes on to say the state of Illinois must begin a phased reopening of the private and public institutions that form the foundation of our economy. Failure to do so poses a great threat to the lives and livelihoods of far more Illinois residents through unemployment, homelessness, crime, substance abuse, and suicide. Joining us now is one of those 5 Illinois Republicans, Congressman Rodney Davis, who sits on the White House Commission to Reopen America. Congressman joining us from his home in Taylorville. Good to have you with us.
Hey, thanks for having me on, Mark.
I want to start with asking you about that letter. Some of the first economic data we've seen suggests that customers were already starting to avoid stores and places of public business and crowded events even before governments started to crack down and tell people to stay home. So if we lifted all restrictions right now, and I recognize you're not calling for that just yet, but if we were to do that, how do we even know there would be a swift economic recovery if people don't know it's safe to go out?
Well, we don't know that. First off, I want to say thank you to my colleague Adam Kinzinger for leading that letter in April. And keep in mind that letter was put out before the governor's most recent executive order that was released later that same day. As a matter of fact, I want to thank the governor for implementing some procedures to open up parts of our economy, starting with our healthcare economy. He realized and recognized and took the advice of people like me, who said we ought to be able to get our clinics and our hospitals open to what he considered elective surgeries that others may consider life-saving procedures. He did listen to me. He did open those parts of our economy. And it's going to allow people to get treated for diseases that we know how to treat because they're too scared to go into a facility, or there might not be a doctor available to see them. Similarly, when you talk about opening our economy, yes, people are scared right now. But as we learn more and more about this disease, we've got to be able to take a regional approach to allow our economy to rebound once again, because people are hurting and they need to be able to feed their families too.
You mentioned that regional approach. That letter also, and I apologize if I cut you off there. We're having a bit of connectivity issues as we dial in remotely here. But you mentioned the regional approach. Governor Pritzker's plan does include those 4 different regions. There's some debate about how big those regions are, should there be more of them. But the phases are interesting. The governor's plan includes 5 phases, not 3 like Dr. Fauci. And the timeline is a minimum of 28 days to jump from phase 2 to phase 3, another 28 days to jump from phase 3 to phase 4. Dr. Fauci has a 14-day timeline in declining coronavirus metrics, where the governor wants to see 28 days of declining or stable. Is that an acceptable timeline to you, considering that bars and restaurants would not be able to allow anyone, and when they could, just a limited capacity in their doors at the soonest, June 25th. Can you live with that timeline?
Well, I certainly hope that the governor can reconsider that and be more consistent with federal guidelines, as he has been and his administration has been in the past. I echo the concerns of our Republican leader, Bill Brady, who brought up the 14-day versus the 28-day issue. But also, when you're that prescriptive on days, you take out that flexibility of a regional approach that should and could be taken. Remember, we sent our letter on April 30th. The governor issued a new executive order with new guidance and partial opening of parts of our economy on April 30th. Now he has taken a regional approach, but that regional approach is going to be limited by the lines that he drew and by the prescriptive guidance of 28 days versus 14 days at a time when we're going to see testing capacity continue to rise. And when testing capacity continues to rise, the amount of positive tests continue to go up too. At that point, how do we ever get to the future phase of phase 5 and begin reopening our economy as a whole?
Well, and they're measuring the positivity rate. So the theory, the working theory, is that the more tests they have, they start testing people who don't even have symptoms, and the number of people or the percentage who test positive should go down, theoretically. That's if the spread is contained. I want to ask you, though, about the... Pardon?
Say, keep in mind, just yesterday, Governor Cuomo in New York City was surprised that 66% of his new cases were people who were sheltering in place outside of going to buy groceries. They were not part of the essential workforce. So we're learning more and more about this disease every day, and we've got to have the flexibility to adapt. And I'm afraid the governor's phased approach is too inflexible for us to be able to adapt to new things that we're learning about the fight against COVID.
All right, very interesting feedback there. I want to switch gears slightly to what the federal government can do. We know there's already been a whole lot of relief given to individuals, but as this goes longer, there's a question of will that be enough for people and for small businesses, but also for states and governments as well. We've seen Governor Pritzker be among several governors go to the federal government and say, we could really use some help here. There's been some already. On Face the Nation just last week, Governor Pritzker said he hopes that whatever federal bailout or support money does come, he hopes there are not too many strings attached. We've seen Senate Majority Leader Mitch McConnell suggest maybe a bankruptcy for states. We've seen Senator Tom Cotton, another Republican, say that the federal government shouldn't bail out states like Illinois. I think you even had some similar comments on a radio station recently. I understand why senators or elected officials from other states might not want to bail out Illinois, but why shouldn't a member of Congress from Illinois support that idea?
Well, just using American taxpayer dollars and Illinois taxpayer dollars to bail out the Illinois General Assembly for not making the decisions they needed to make to put Illinois in a better fiscal place is not something that any member of Congress should just rubber stamp. Look, we're all for our home state. We're all for helping our home state. Matter of fact, in the first 4 phases of our fight in Congress against COVID-19, we've sent hundreds of billions of dollars to Illinois, be it in the form of direct funding going to larger communities and to the state, which many of those dollars we fully expected the governor to be able to filter down as a pass-through to our local communities that are hurting. His administration has yet to do that. As a matter of fact, in an article in the St. Louis Post-Dispatch yesterday, St. Louis city leaders are concerned that the Republican governor didn't follow the intention of our law by getting dollars from the state down into the St. Louis communities. I think the same concerns can be raised to this administration here in Illinois. But let's not kid ourselves, Mark. The hundreds of billions of dollars have come to Illinois and Illinois facilities. And at this point, the governor not taking the dollars that we've already given him, that we all intended, Republicans and Democrats, to be given to our local communities to help, it's not looking good for more flexibility for governors like Governor Pritzker in the future. I think there's probably going to be bipartisan support to put some limitations. And maybe if we're able to come up with a good bipartisan solution, the money will go directly from the federal government to our local communities.
And that was an interesting thing, too. So early on, even Senator Durbin, joining us earlier in the program this week, told us that he thinks that it is responsible to have some strings attached, or to make sure that however the states spend the money is related to the coronavirus. But if you listen to Governor Pritzker and other elected officials, they'll say, look, we took a hit too. All the taxes we would have collected on income, on corporate income, on sales tax, we couldn't collect that money because of the coronavirus. So all that money that would have gone to human services, or would have gone to education, or would have gone to the pension debt for our police officers, firefighters, and teachers, that money just isn't there now. So they're saying that the coronavirus blew a big hole in their budget, and it's reasonable, therefore, for the state or for the federal government to fill that hole created because it was created by the coronavirus. Is that a fair argument, do you think?
Well, we can deduce that all of the problems that exist at the state and local governments could be due to the coronavirus, especially where they are now fiscally. But at the same time, we can't not take a step back and see what we've already done at the federal level. Really, our bipartisan focus, and Senator Durbin, I'm sure, would agree, that has been on really ensuring that our state and local governments have a local and state sales tax base to go back to once we beat this virus. That's why we focused on our mom and pop shops, our small town businesses, and those businesses and entities were eligible for the PPP program. Bridge funding, if they meet certain metrics, is going to get them through this downturn and make them a viable part of our communities once we beat this virus. If we were not able to focus on those issues, then our local communities in our state wouldn't have a sustaining local and state sales tax base to go back to. So we focused where we needed to at first. Now we're willing to discuss local funding, but that's not without the governor being held accountable for making sure those funds get to our local communities who need help too.
It'll be interesting to see where that debate goes in the days and weeks to come. I want to go back to a topic we asked you about last time you joined us, back when the coronavirus was still early in its phases and the public was acclimating to this, but we were already seeing, I believe, the second or third week of just massive unemployment at the time, and that trend has continued. People continue to lose their jobs, which for many Americans is the primary source of their health insurance. Weeks ago, we asked you, should the White House or should Congress reconsider reopening the Affordable Care Act? At the time, you said you didn't know if that was the answer. I'm paraphrasing you. But then just 2 weeks ago on a local radio station, you appear to have changed your mind. You said, quote, I've recommended to the White House, why not open it being the Affordable Care Act, up for a time being. Who did you speak to and what did they say? How did they respond?
I spoke to the administration. We spoke to our folks that are our contacts over there in the legislative office, and why not? They said they'd take it into consideration. But the fact of the matter is, just opening the ACA is not going to be the panacea. As I said before, if somebody who is unemployed gets access to sign up for insurance through the ACA, they may have a better route through COBRA or keeping their job, as we're trying to allow them to do with the PPP and other funding sources. So we've got to make sure that we lay out a plan that's going to allow for maybe subsidies for COBRA coverage so that the employee can have consistency within their healthcare and within their healthcare system that they're used to utilizing. But again, if you just use the ACA, many people who didn't sign up for the ACA when they were self-employed or had access to capital to do it, what makes you think that just opening it up and having them try to pay for the exorbitant premiums and deductibles now is going to be easier for them? The only people who want to focus just on the ACA are political opponents and those who want to make a political issue. You've got to take a holistic approach to making sure that we give access to healthcare to those who were recently unemployed. And frankly, organized labor and business groups have come to me because they believe COBRA is the best way to do that through helping those who may need subsidies.
So it sounds like you're saying that in your opinion or your view, it may not be the best option, but you're okay with it being an option right now in this dire time. Why did your thinking evolve there?
Well, it didn't evolve. You asked me the question, and I said, I don't necessarily know if that's going to be the panacea, but I did take it into consideration. And I don't think having options is a bad deal, but let's not kid ourselves. The ACA right now has priced itself out of 60 million Americans being able to afford to buy a plan, or frankly, 31 million of them being able to afford to use the plan that they purchased on the ACA exchanges.
Yeah, it's certainly not a perfect scenario. Very few things in health insurance are. But one other thing happening at the same time, even now, the White House administration lawyers are supporting a lawsuit in court right now that could disrupt or dismantle much of the Affordable Care Act. In the past, your political opponents have pointed out that you've supported that. Should that slow down for now? Should that lawsuit take a breather if it can, while you're saying that you now support this idea that maybe some people should be able to reopen the Affordable Care Act? do you still support that lawsuit that would threaten to interrupt that?
Well, I'm not signing on to the lawsuit. Look, I voted for a plan that would have lowered premiums for millions of Americans, would have provided them the access to the care that they need and deserve. The economy that was eviscerated just weeks ago by this virus provided millions more Americans access to greater health care and better health care than what they would have received on the ACA exchanges with the exorbitant prices many are being charged. So we need to rebuild our economy and get people back into their employer-based health care. And that's the key. That's the reason why we think we should take a phased-in regional approach. And those are the ideas that are going to get people access to health care. That, along with the fact that I was successful in urging the governor to open up our access to primary health care facilities and healthcare procedures. Remember, what may be considered an elective procedure by some is considered a life-saving procedure to others. I was on the phone today with the leaders of our Illinois primary healthcare centers, our immediate access to primary care for many Medicaid recipients and underinsured individuals in this state. And they're the ones that have thanked us at the federal level for providing them dollars to be able to buy the PPE necessary and still continue to serve our patients. But there's a fear within those providers that people are scared to come to the doctor. People are scared to get that health care that they need and to get those tests that they need. So we instituted more flexible telehealth opportunities to allow them to see individuals, and those individuals who are seeking mental health treatment have skyrocketed over this COVID pandemic time period. So we're doing what we can to not talk about the politics of what's in the court, not talk about the politics of what my opponent and her allies want to address on the exorbitant cost of the ACA. We're actually trying to get people the access to care that they need, and we're succeeding, but we've got to change the message. The message is, if you're sick, you can safely go to the doctor. If you need help, there are ways that our doctors can see you via telehealth to get you that assistance.
Mm-hmm. And you mentioned the push to find PPE to protect medical professionals and other workers on the front lines. In that earliest phase, there was this panic in the markets to find those supplies. Just this week, the Washington Post and New York Times have reported that the Department of Justice opened this criminal investigation. I know you've been asked about this in recent weeks as well. This Blue Flame medical company is now under the scrutiny of the Department of Justice for trying to sell states masks and ventilators, but when the states coughed up the money, they just didn't have the goods. It was one of your former fundraisers, Mike Gula, who started this company. He's now being investigated. He worked for a number of Republicans, and I understand his departure in leaving politics to pursue profit here caught everybody off guard, yourself included. He didn't really give a lot of advance notice and just sort of saw this avenue here. But just wanted to get your reaction to, again, we're seeing the DCCC and other people saying things like you should return the money that he raised for you, making a political issue. But how do you speak to the character of Mr. Gula and him being one of the cast of characters sort of in your orbit there? Is there anything that you'd like to respond to about that issue and what he's tried to do here?
Well, clearly, his character of when he was working for me and doing the job I asked him to do was much different than the character I expected when he called me one day and said, well, I'm not going to be doing this anymore. As a matter of fact, we sent a letter notifying him of a breach of contract, and he's going to have to answer to any of the accusations that have been out in the public. And frankly, that's going to be up to the Department of Justice to determine whether or not he in his new capacity broke the law. But he did the job I asked him to do when he was working with me, but he chose to breach our contract. He chose to go into a new field and not give any of us notice. And I moved on that same day to somebody else who's helping me in that field. And I'm looking forward to working with them in the future and looking forward to a new beginning when it comes to a new person that's taking on that challenge for our organization.
Yeah, and I wonder, aside from the personality involved and I've never heard of Mr. Gula before, but aside from his issue, what does it say about the broader healthcare market itself when people see profit and they jump in. You want that incentive, right? Because you want the PPE, you want the ventilators, you want there to be companies rushing to solve problems and to provide fixes. But then you have to counterbalance that with people who see, people profiteers who see that as an opportunity to price gouge or to milk it for all it's worth. How do you strike that balance, and what can the federal government do to make sure that people who are only after profit, who can't deliver on their promises, are sort of taking advantage of people who are in a desperate situation? How can we extrapolate from that a lesson of fairness or justice in the future of whatever our healthcare markets might look like?
Well, you do what's happening right now. Those who are not able to fulfill the promises that they made and maybe taking advantage of entities who are in dire need of equipment, they're going to be investigated by the U.S. Department of Justice. So the process is working to try and investigate the bad actors. And time will tell if those investigations pan out, if anybody was guilty of doing something nefarious or not. But in the end, we've got to come together as Republicans and Democrats in Congress to actually address the future of a PPE national stockpile in a future pandemic. I think there's bipartisan blame to go around for decades over the fact that a focus on a real national stockpile that was going to help our healthcare facilities and all who needed PPE to get it, it was a failure. It's been bipartisan failure. I can tell you in 7.5 years in Congress, I haven't had somebody come to me directly and say, we've got to focus in a bipartisan way to really define what a national stockpile means. And let's make sure that we put forth the federal funding to allow that stockpile to be produced here in the United States and ready to go in the case of a pandemic that none of us prepared for. So I think the blame is less about, putting forth or looking backwards a few decades to many I served with who got to Congress long before I did, and those who I serve with now. The blame can be had looking forward. If we don't address this in the future in a bipartisan way, then we all should be blamed for not knowing how to address PPE needs and production needs in a pandemic when we've been through one for the first time in our lifetime.
Yeah, it's certainly going to change our conscience in the way we think about preparing for a pandemic, and we look forward to hearing from you and your other colleagues across the aisle and around the state about ways to prepare in the event, God forbid, that something of this scale or magnitude should rear its head again in the future. Congressman Davis, one of the better backdrops, I got to say, of many of our guests joining us there. It looks like a peaceful day outdoors. Thanks for joining us.
Thanks, Mark.
All right, we're back in just a moment.